Lately, the UN-affiliated Pan American Health Organization reported that COVID cases are accelerating in North America, driven primarily by a surge in southern and eastern United States and central Mexico. This spike is blamed on the highly infectious Delta variant of the virus. The organization has stated that COVID cases in the United States are up by a third. The United States is currently the worst hit nation in the world in terms of infections and fatalities. So, who is to blame for this situation? Last week, Texas Lieutenant Governor Dan Patrick blamed the unvaccinated African American community for the latest COVID surge. The Lieutenant Governor's remarks drew criticism, as some called his assertion baseless. The latest data from the state of Texas Department of Health Services shows the highest coronavirus case rates are among whites and Hispanics, who make up over 70% of the state's cases, not the African Americans. Meanwhile, African Americans are more prone to the COVID-19 as they are twice as likely to die compared to their white counterparts. For instance, in the capital, Washington, D.C., African Americans account for 76% of the COVID deaths, while they make up less than half of the population. In addition, they are less likely to get vaccinated amid the variant spreads. African Americans have received smaller shares of vaccinations compared to their shares of cases and the total population. Out of the 58% of people who had received at least one dose of the vaccine, nearly two-thirds are white and only 10% are African Americans. But COVID-19 is not the only problem they are facing. As the pandemic started last year, many working-class African Americans struggled with housing costs and faced eviction, as rent rates increased faster than their incomes. That's the best example of economic inequality in American society. Another issue that has plagued American society is racial discrimination and police brutality. According to various studies, African Americans are far more likely to be shot, arrested, and imprisoned by police than any other racial group. Many African Americans are reluctant to receive COVID jabs. This unwillingness is the result of distrust that formed after centuries of injustice toward African American communities. Vaccine hesitancy among African Americans is rooted in the historical mistreatment of the community by the U.S. government and medical institutions. One of the most horrific chapters in U.S. history is the infamous Tuskegee experiment. In 1972, a report exposed that the U.S. Public Health Service had conducted a 40-year experiment at Tuskegee Institute in Alabama on hundreds of impoverished black men with syphilis. They were deliberately left untreated so doctors could study the disease. Many of the men died of syphilis and its complications. Some of their wives and babies were infected as well.
What was done cannot be undone. But we can end the silence. We can stop turning our heads away. We can look at you in the eye and finally say, on behalf of the American people, what the United States government did was shameful, and I am sorry.
The experiment added to the deep distrust many African Americans have toward the federal government.
Yeah, because this idea of brutality, colonial brutality, has persisted throughout the history here. I mean, I know that some people would like to talk about Tuskegee, the Tuskegee experiment that lasted for 40 years here in the United States of America from 1932 to 1972, where white people used African men as test studies for the development of syphilis in human beings. And so some people say that our distrust, being African people's distrust, is based on that kind of history. But again, African people all around the world have sense enough not to trust anything that the colonizer says is good for us, because nothing they've ever said is good for us has been.
Racism and injustice, unethical medical experiments, and slavery all have contributed to the distrust that was in making for centuries.